Hello, and welcome to today's webinar to discuss our technology-enabled CDI solution for the ED. My name is Tracy Molina, and in just a moment we'll be joined by our presenters, Elizabeth Morgenroth and Mike Rosenfeld. If you have any questions that you would like to submit for the Q&A at the end of the webinar, click on the icon with the question mark and type in your question at any point throughout the webinar. We'll gather these questions and try to address as many as time permits at the end of the session. If we don't get to your question, we'll follow up with you one-on-one. We'll provide a recorded version of this session to all attendees in the event you want to go back and review the material, or if you'd like to review the material with a colleague who is unable to attend. With more than 16 years of experience in the payer, provider, and vendor areas, Elizabeth drives the development of the T-System encoder tool and ICD-10 readiness services. Mike leverages his 14 years of experience in documentation, improvement, training, and product management to demonstrate the value of T-System offerings for prospective clients. And now to kick off our presentation, here's Mike.
On today's webinar, I'll provide an overview of the T-System and our offerings. We'll talk about CDI services in the emergency department setting, the challenges associated with those, and T-System solutions. And as time permits, we'll take questions at the end of the session.
So just a little bit of a refresh background on who the T-System is. We currently have 1,500 client sites across the country utilizing one or more of our clinical workflow or revenue cycle solutions. That means on a yearly basis we touch about 40 million or so visits in emergency departments across the country. We are headquartered in Dallas, Texas, but we do have an operational center in Kansas City, Missouri, where we perform our facility coding and charge capture. So as far as the types of individual T-System employees and who we would leverage their expertise and skills in our CDI offerings, just to give you a little bit of a flavor between the blend of clinical and coding leaders who can assist clients in their CDI initiatives. So our physician resources, Dr. Ward and Dr. Hitchcock, have been involved with the development of our clinical content and our ICD-10 solutions. We feel that's a unique benefit to have a very heavy physician input as we drive forward towards ICD-10 go live. In addition to that, we have HEMA-approved ICD-10 trainers who can work with both your providers and coding staffs. Elizabeth and Jeannie bring a number of years of experience in those roles, and Jeannie Ruse, not on the call today, actually heads up our organization's quality assurance department for all of our coding initiatives. So let's look at what type of guidance and goals exist for an effective CDI program. So one of the there's various lists of goals and objectives that CDI can accomplish, but one of the HEMA has published the following list here. And as we kind of touch on these, think about how and if your CDI program, if you currently have one going, address these needs in the emergency department. So be it that include a concurrent review of medical records, obviously physician training, what your query process may look like, alerts for incomplete documentation, and then obviously a periodic review of documentation. So within the ED, CDI efforts face unique challenges. In fact, in some cases, the ED has not even been included in the organization's CDI efforts. So as you evaluate, as you start to look through your CDI solutions, think about how you're going to meet the needs of the training needs for your emergency department physicians. Given what the types, the broad spectrum of visits that emergency department physicians see on a day-to-day basis, how are you going to train to the level of specificity required there? Think about also how you might provide better feedback in terms of a chart review. Concurrent chart reviews are often impossible due to the obviously the short duration of stays that most EDs see. Additionally, as we've touched on already, your query process. How do you communicate with your ED physicians? If you're in a more rural part of the country and your ED physicians are gone for several days at a time, how do you communicate with them in order to get the complete documentation you need? And lastly, as you look at your EHR or your current documentation tools, the types of or the standardized content that comes available, are you required as a facility then to build your own content, and do you have the IT and clinical resources to support that initiative? So so again, I just kind of reiterate, as you look at your CDI program, ask yourself some, look at the following: what efforts exist currently for ED clinical documentation improvement? How do your current ED solutions help? What are your main issues with documentation from the emergency department? And again, how do your current ED solutions help? Who handles your ED charge capture and coding? Is that optimal or sustainable for your hospital? As I mentioned, your plan for ICD-10 readiness. That's an important component here as we go into the next about 10 and a half, 11 months leading up to next October. Are you back on plan with regards to your ICD-10 readiness from a training and also from a documentation and systems standpoint? And do you have a physician coder query process currently? So as we look a little bit further at what we'll bring to the table and to produce an effective ED documentation improvement solution, we'll look at both episodic and ongoing engagements with your providers and your coding and your business staff. So over the next several slides, we're going to describe in more detail the solutions T-System provides. So these solutions can be pieced together a la carte or implemented in total. We really do customize it based on the needs of your facility. So as you look at this slide, Elizabeth will talk about here in the next few slides, providing initial baseline, and that includes a chart assessment, also some provider education, and then ongoing and continuous documentation improvement. You're looking at how do you couple your tools and your processes within your facility to produce the best outcomes. Can we provide opportunities to participate in your training mechanisms? We have solutions for that. Can we provide opportunities to provide charting solutions? We have the ability to do that as well. And then look at your business process from a charge capture and coding standpoint and evaluate how that plays into your CDI efforts. So with that, I'm going to turn it over to Elizabeth, and she's going to cover the initial optimization. Elizabeth?
Thanks, Mike. Exactly what we do, the initial optimization, is a baseline assessment of your facility's documentation, and we'll start with this next slide. And I want to point out that our assessment doesn't have to be just ICD-10 oriented. As most of you are already aware, we've had to be the bridesmaid for 2 years and not the bride with the continual delays with ICD-10. I'm a strong believer that great documentation today will support ICD-10 coding for tomorrow, and there's a great deal of information. I think most coders and HIM professionals will agree with me when I say that the documentation that most of us see, even in the emergency department, could be more specific. There are better ICD-9 codes out there. We're just not using them. So I just wanted to point out that we can support ICD-9 coding today and give physicians some feedback on that as well, not just for ICD-10. But this is an optimal solution for clinical documentation improvement with the idea of being ready for ICD-10 for the emergency department. Our methodology is we will take your facility's top 25 ICD-9 diagnoses. So we're going to take a look at what you see most often, look at most of the time, and we will code those charts completely out in ICD-10, not just the primary diagnosis, but anything else along with it, because obviously maybe the primary diagnosis isn't where the most improvement needs to be made. So we'll look at that in general. Then we use a standardized rubric for that documentation. And because every chart has a primary diagnosis, we'll apply that rubric to the primary diagnosis. And what we do is it's very simple. That gives you quantifiable, objective information to go back to your physician and say, physician, 50% of the time you're providing us with the most information possible to assign the best possible ICD-10 code. But guess what? 40% of the time, you could provide us with more information. We can assign an ICD-10 code, but we're pretty sure that you know more information that you could have given us to assign a more specific ICD-10 code, and 10% of the time, we would have to query you because either your documentation using your system is contradictory. For example, you're documenting probable gastroenteritis, but in your documentation solution checklist, you're saying it is gastroenteritis. So is it probable or is it really gastroenteritis? So if we see any contradictory information, we would say we'd have to query you, or if there's going to be some situations where it would be very obvious in the documentation that a physician query would have to take place. So we'll give you that feedback and where that happens. Not only do we want to focus on where the documentation improvement needs to be made, but we also want to point out where the successes are with the physicians if we find it. So and here's an example actually on this slide of where the physician gave the best possible documentation to support a most specific possible ICD-10-CM code, acute cystitis with hematuria. So that pretty much says it all. So we're really focusing on what you do most often, analyzing that information. Then we will provide an executive summary of that information. And thank you, Mike, that was perfect timing. Once we have completed that executive summary and have made that initial presentation, then we have the option of doing customized physician training based on that information. So the executive summary gives an overview of where the trends are, where the improvements need to be made. However, we can go either on-site or provide physician engagement training remotely. It's probably better on-site, so it's face-to-face, but we can do it either way. And it would be customized based on the results of your assessment. So we're going to be not giving generalized documentation improvement, feedback to physicians, but based on their own documentation saying, hey, you're doing this great, here are the specific areas where you need to improve, so that we are addressing the needs of that particular physician. We find that it works a lot better when we're not trying to give generalized information, because a lot of times they don't have a lot of time for that, so we're going to only fight the battles that we need to fight. And then we can also take that information, look at if there might be any implications on the reimbursement, and go over that with the HIM directors, revenue cycle directors, and so on and so forth. Obviously, we'll talk about key documentation elements. We'll walk through, again, those top conditions. We might go through injuries in addition to that. And then we can go back and circle back after a certain amount of time and do, as I said, this is a baseline assessment. So after we look at the additional CDI solutions that Mike has to bring to the table, we also offer the ability to circle back and do a reassessment following the initial baseline assessment and initial physician training. So with that, I'm going to hand it back to Mike with this additional solution.
All right, thank you, Elizabeth. So beyond the assessment and training that Elizabeth just described, T-System can provide solutions to promote ongoing improvements in your provider documentation. So first one of those we'll cover would be documentation training guides. For years now, T-System T-sheets have been gold standards in terms of emergency department documentation solutions. We've actually modified those slightly to create training guides. The training guides then can be used as you onboard new physicians, refresher training. Again, as we move up, these activities will start to become a little bit more urgent as we move closer to the eventual ICD-10 implementation date. These are sheets, again, that we would maintain annually as needed, just as we do now for all of our clinical content. And really the goal of having the training guides would be then to illustrate for your providers the areas of documentation for ICD-10 specificity, for quality measures via Joint Commission or other regulatory needs. And then also, obviously, we can, we'll continue to put your reimbursement needs in there as well. Beyond that, we do have electronic documentation solutions that can be leveraged in the CDI process. And really the goal here would be that CDI really, is the big, a big piece of that starts right at the patient, the point of patient care. So if you're, the old saying, if, garbage in, garbage out. So you want to correct the bad documentation behavior and reinforce that in real time as much as possible. So we do have charting technology, which does provide real-time documentation feedback to the provider based on their level of documentation. This is an example we have of a radius fracture, and you'll see a few things here. You'll see we obviously have a visual layout which walks the provider through the different areas and different requirements for their diagnosis recording there, and we also have feedback that'll go on behind the scenes. So each of these are laid out again for a very specific purpose, so that the providers can see and receive feedback if they failed to mention again the place on the bone or maybe laterality with regards to the particular fracture or bone that was involved. So this is something that is set to be released here in very short order. We do have a patent pending on that approach, and very excited about how we may help your providers help ease some of their concerns and their fears about what and how they're going to have to document when it comes to ICD-10. Great thing about T-System clinical products, all the content that you see here is predefined, comes out of the box. So again, doesn't require the facility to expend valuable IT or clinical resources to help develop that clinical content for your documentation solution. Obviously, last, clearly, we do have the ability to generate those ICD-10 codes based on the documentation. So again, some assistance then that we would provide to your back-end process from your coding perspective. Beyond just looking again at the documentation or the ICD-10 implications, a few other things that I would highlight for you with regards to the electronic documentation solution. One is, probably one of the key ones is that we have the ability to maintain an up-to-date problem list within the electronic health record. So this is going to help with your with continuing to capture your chronic conditions and maintain an appropriate list there. And then also, and we're going to talk about it in a little bit more detail in the next slide, is the ability to capture and maintain good performance within your quality measures. So I would point out before we leave the charting slide here that we do have a full EDIS available. We also which would include our CPOE, as well as have the ability to provide an EV for physicians only solution, which can overlap nicely if you're have an enterprise vendor in place that your facility is interested in maintaining. We can actually provide the solution just for your providers. So let's take a look a little bit with the compliance with the quality measures. Obviously, there's a lot of visibility within these quality measures. Various public websites with information on how these perform. Obviously, then the reimbursement impact as well. So from an inpatient quality reporting, outpatient, the hospital acquired conditions, very important. PQRS for your physician groups, to keep them happy. But the real takeaway here is that the ease of use for the T-System clinical content, having the visual cues within the content, within the right place within the provider workflow in order to collect that information. T-System EV leads the industry in terms of physician adoption rates. So your providers are not going to object to using these tools. And lastly, again, with having the content defined appropriately in the right way, you're going to have a high degree of structured data in terms of your clinical documentation. This means that we're not typing narratives. It's going to assist with your ability to mine data from the system. Keep in mind, most systems are not going to be able to really quantify or qualify free text or hand-entered information into your documentation solution. So I think those are a couple of key value points. So as we move past the documentation, really takes us to the back end in your coding function and process. So T-System does offer coding and charge capture services. We have a SaaS-based solution, or we have a full service solution. Both of those include QA. We do pre-bill QA on a number of your visits, and you'll see that each day. And so from that perspective, as far as a service offering, all of that information that we're able to capture and record within the system, again, we can help feed back to your providers, your clinicians, and to further drive improvements in their documentation. So let's look at what the ICD-10 solution looks like. So as we try to couple these together. So obviously, we've spent a lot of time and energy around developing an ICD-10 coding solution. Again, very specific, very dedicated to the emergency department setting. What are those codes that are most important for your providers that are gonna really need to make sure that your coders can interact with solidly. So we have pick lists, customizable pick lists for rapid selection of diagnosis code. So this is going to be, as we go through, we've enabled those, again, ED-specific ones to bubble up to the top closer. And as I like to say, we can't do anything about the 68,000 or so ICD-10 codes. What we need to focus on is how do we allow you to identify those quicker and easier. Flexible searching. And this is this is using more natural language processing. This is using how the providers are going to document to be able to find those ICD-10 codes in your system. Common code paths, again, that are very ED specific. Having a hierarchy within the code set, which allows the coder to more walk themselves out to the appropriate and certainly in a fracture care case, as we have demonstrated here, 7th-digit code. Providing guidance on sequencing of those codes, obviously, again, is going to be another key element, as well as capturing those additional codes when applicable. So for your respiratory type complaints that are looking for your smoking status, that's going to be a big thing. How do you quickly and easily capture that information within your coding process? And lastly, and this touches a little bit on what Elizabeth had talked about, is the ability to now, before we get to ICD-10 Live, is to actually capture and provide feedback through, again, a very similar rubric that we use in our assessment to demonstrate to the providers where they may be deficient in terms of their documentation, where they could be more specific, or where they've been as specific as they can. So that way you're reinforcing those good documentation patterns as we move towards ICD-10. I would also mention a few other benefits here would be around dual coding. We're going to support ICD-9 and ICD-10, certainly in the interim and then beyond the go-live date for ICD-10 for as long as necessary. And then also would be the impact on your revenue cycle for the turnaround time that we offer in terms of providing coding services, which presently right now is right about at 36, 38 hours or so from the time we receive a completed chart till the time it's returned. So those are a couple of functions and processes and tools that we have available, which are great. But then, how do you get insight into what's going on within each of those functions? So we do have a number of pre-built reports. We also have ad hoc reports. So there's over 150 operational, financial, regulatory reports within both EV or our coding platform, which your CDI team can leverage to identify charts for review. When we look at some of those examples that we have shown here, you can see that those really the goal here would be to allow you to slice and dice better, identify visits or types of visits that you would want to go focus your CDI efforts on within the ED. So if you're looking for specific diagnoses or you're looking for specific procedures, looking for potential provider deficiencies, just want an account that would tell you, hey, give me all the accounts that had a sedation performed, because that's what we're targeting for our CDI initiative here. If you're looking at missing stop times for your infusions and hydration services, if you're looking at other documentation initiatives, which this is an ability we have within our coding platform to capture and record data for your facility. So that really can be either there. If you're looking at medical necessity and how that plays in with your denials, we have the ability to track LCD and NCDs and whether your providers are passing and failing. That's going to go really nicely with capturing the reason for study within the clinical documentation piece and CPOE. So again, just really, and then obviously the last one, and I think a real key one as it plays into revenue, it would be your coder QA reports. Each coder would have their own QA report, so you could see how those individuals are doing in terms of capturing the correct diagnoses or CPT codes. So beyond that as well, we mentioned having the query process be a key part of your CDI initiative. If you don't already have a query function within either your EHR or within your HIN department, we can assist with that. We are working on a customized physician query template. Again, this is going to be very specific to ICD-10, very focused on emergency medicine and how you interact with and communicate with those providers so that they can see clearly what needs to be recorded. This is another good back-end training tool. So as I go to close, just want to reiterate a few of the key benefits here. And again, I think that as you look at the suite of solutions and services that we provide, I think there's some key benefits, certainly around the reimbursement and compliance. Be it that we're providing the feedback on the front end with those providers. We're less denied claims whenever ICD-10 non-specified codes are used as a stick. Then certainly your providers are going to be better positioned for that. From a coding perspective, our coding platform with the algorithms and the QA are going to lead to more accurate coding, going to drive higher reimbursement. From an efficiency process, again, we don't want to slow down the input mechanism, so we're not making this overly burdensome on your clinicians, and then we're also going to promote. It's going to promote better efficiency on the back end, with your coding function as well. So hospitals are overburdened in a lot of different ways. One of those might be, how do we assist with your training and help you reduce your demands and your workload in that area, and then also really kind of take out that need and that urgency for having someone review those charts in a very quick, timely basis, particularly as your volumes continue to rise, as they have over the last several years. So how do we get on top of that particular piece? Okay, so this concludes our presentation. So I want to thank you for your time. Right now I'm going to go ahead and pass control back to Tracy, and she's going to coordinate the Q&A. Tracy?
Hi, thank you, Mike. Yeah, we have a couple questions for you. One came in. They have another solution for inpatient CDI, and they want to know if that will work with their solution.
Okay, so good question. Absolutely. Really, what we're focusing on here, is being able to leverage the tools and technology we can put in place in the ED. And so, if you have a broader, solution within the inpatient setting, that doesn't conflict. There's probably a lot of benefit we could do there. We could also, explore various opportunities to provide data to those solutions. As we mentioned a couple times in the presentation, I'd like for it to just be a takeaway. We've described a lot here. Really, then the benefit would be, working with each prospective client and customizing our approach with them, so that we're not either making redundant processes or solutions, and we're getting the biggest bang for your buck.
Okay. Great.
Oh, and if it's okay, I'd like to speak to that also. This is Elizabeth, and what I'd like to say is that even if you have an inpatient CDI solution in place, hopefully you can appreciate that your inpatient solution, your outpatient solution, or your inpatient and outpatient CDI needs are going to be different. Take into consideration the code sets that are involved, and the documentation needed. So, for example, your inpatient CDI needs are going to be quite different than your outpatient needs, because the CDI the need for CDI, especially for ICD-10 PCS for the inpatient procedures, is you're going to be having to look at your approach and devices and so on and so forth. And so those needs are going to be entirely different from what you're going to see as CDI needs in the emergency department or your outpatient services. So our solutions are geared and tailored specifically for the emergency department. So hopefully they'll be leveraged even better and more effectively with your, to run right alongside of your facility's program. In addition to that, you may be having to take resources away from your outpatient CDI efforts to put them toward inpatient, just for the reasons that I just specified, that the CDI needs to support ICD-10 PCS are very, very large. So you may need to look for other ways to support continuing CDI for your outpatient services.
Okay, thank you. We have another question. They have a Paragon system in their ED for documentation. How will this work with that?
Okay, so again, I mean, this goes into really customizing the approach and the solutions. If that's the clinical documentation environment within the ED, and that's not subject to change, certainly the training and the training tools, the assessment, the various benefits of the revenue cycle offering would still all apply. We are, for large part, agnostic in how we provide, many of our services. So again, you wouldn't really have a lot of conflict in that particular situation.
Okay, wonderful. Well, I think that's all we have on the questions. We'd like to thank you all for attending today's session. This concludes today's webinar. On behalf of all T-Systems, thank you for joining us.